Today we have a little dog, Maltese cross, that has a soft tissue sarcoma on the digit right here. I don't know if you guys can see it right there. And the lymph node is also enlarged and quite firm. So I'm going to go ahead and take out the lymph node first, and then we'll go and do a toe amputation. Toe amputation I'm going to do by transection of the metatarsal bone above the tumor so that we can get a clean margin on it. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. I will need an oscillating saw with the smallest blade you can find and a couple of homins, baby homins. All right, so I'm going to do my initial incision. Remember that the saphenous vein runs right up along the side here, so that's going to be just very, very close to that popliteal lymph node, so we'll try to avoid that. Not catastrophic if we cut it, but I'd rather avoid it if I can. And popliteal lymph node removal it's almost like a dog castration where you cut the skin and then just try to push the node through the hole in the skin that you've created. So now I'll just try to find this node. I'm pushing it out through the skin here. Can we get some Gelpies, please? Piyush, can you grab those Gelpies? The Gelpies, please. Thank you. One more. So there's that saphenous vein right there. There's the node right there. Once I've gotten through the skin, it is smaller than I initially felt like it was going to be. But I still think that it's kind of firm. It'd be pretty unlikely that a soft tissue sarcoma is going to spread to the lymph node. So that's it right there. And you can see that it is a bit enlarged and maybe a bit firm. All right. Can I get some 3.0 PDS, please? So that's the lymph node there. That's that saphenous vein right there. A little bit of bleeding. So that was popliteal lymph node removal in a little dog with a soft tissue sarcoma on its digit. And you definitely do not need a drain in this surgery. I would say a drain would be counter counterintuitive, like it would be the wrong thing to do. It's not like you can do it if you want. There's no reason to put a drain in here, and a drain is going to increase your risk of infection. Contraindicated was the word that I was trying to think of. Yep. Can I get the table up a little bit? You might have to come around this side. That's great, thanks. So I don't use antibiotics in a case like this, and I don't put a drain in. Now this is a low-grade soft tissue sarcoma on the toe, and so I'm going to do a marginal excision. And marginal excision of soft tissue, low-grade soft tissue sarcomas on the extremities are associated with only about an 11% recurrence rate and 0 metastasis rate. And you can cut that closer. See how it's still sticking out? So So cut it right on the skin. Yep. Thank you. All right, so now I'm going to adjust the camera and the lights to get down onto the foot. All right, so moving distally. All right, so, and there is no invasion radiographically, but it's definitely adhered to the bone, so we are going to have to go ahead and take that. Now, it's got these funny little lumps on the foot, warts, yeah, so, all right, so what I'm going to do, can I get ligashore, please? Get that plugged in for me, please. To start with, I'm not going to put on a tourniquet. So I'm going to try to get a margin around. So I'm palpating that second metatarsal bone. So I'm right down onto the bone and tendon there. Can I get the little gelpies as well, please? There's a chance that I'll have to leave this open to heal by second intention. I'd rather get that clean margin. Go with my bigger gelpy. The other thing I'm intentionally trying to do is avoid the previous biopsy tract as well. All right. So this is a cavoodle, and I'm not worried about those warts particularly. They look benign to me. It's possible, like I've just never seen anything like it related to a soft tissue sarcoma on an extremity. So the likelihood that it's involved is very, very slim. Dog's starting to react a little bit. Have you given some more Alfax? Yeah. Great, thank you. Just move the camera distally a little bit. Going through the rest of the webbing there. And we'll do the same thing on the other side. Pish, can I get you around here, please? Come around the other side. And then just blot for me. So take the gauze, blot, and then move it to the side. Okay. So I've just cut through the extensor tendons on that fourth digit. And I can use my Alice tissue forceps on that skin because I'm taking the digit out. Okay. Have you switch sides, please? And if I sacrifice the extensor tendons on the other digit, I'm not particularly concerned, because dogs can definitely do without extensor tendons on their digits. It's one of those interdigital vessels. So now we need to try to separate those digits even a bit further. You know what? If we could get a bone cutter rather than a saw, I think that'll be fine. All right, so we've got that isolated pretty well. So I'll cut through that way, through the bone, and then I will dissect underneath. So there's no issue with amputating this digit at all as far as function is concerned. This dog had thoracic radiographs and a biopsy. Biopsy confirmed that it was a soft tissue sarcoma. And the dog is 10 years old, and it's that's a pin cutter. I need a bone cutter. I beg your pardon? Yeah, I just don't think I can fit it down in there. Yep. Thank you. Okay, so I've cut through that bone, and then we'll grab it with a towel clamp, like that. I've got the sesamoids down there that I'm going to have to cut through that joint right there. Okay, I'll come around the other side. A little bit of bleeding here. Scratch pad, please. Thank you. So I just cut through that flexor tendon for that digit. So now I'm just cutting through the connective tissue. Okay, so now we've got that toe off. Sarcoma is there. So that's all the sarcoma. We've got a good tissue margin from what I can tell. So we should be in pretty good shape. Can I get some bupivacaine, please? Yep. About 5. How much does the dog weigh? 50. So yeah, 5 or 6. So that's the cutoff bone right there.
And then we send the lymph node afterwards.
Yeah. So I'm injecting bupivacaine. And then I'm going to start closing the webbing first. I might switch sides with you. Can you hold those toes apart for me? Yeah. And I'm putting the knots inside, buried, so that I don't have anything that I have to remove. Yep. Both. Once I close this deep surface, I'll go back and make sure that I have all the bleeding under control, because I don't want to get a phone call in the middle of the night saying that we're getting bleeding from the toe and that I have to go back in surgically and find it. Grab us a new gauze, please. Thank you. And I'll do the same thing on the other side. I know you can stay where you are. Can I get some more 2O PDS, please? Just hand it to Piyush, please. So basically I'm doing like a 2-layer closure. So I'll close that deep layer first. Keep holding that. Just hold that out like that, please. This is a very good dog and a very sweet dog, and so I'm not too worried about taking out stitches, but I will try to do intradermals if I can. So you can see how that's starting to come together. So there's a question, if this dog had pododermatitis, would I use antibiotics? I probably still wouldn't. I'd rather, I don't think that antibiotics are really going to help prevent an infection. I'd rather, just if it got an infection, to treat it afterward.
Was it Popliteal, like,
Sorry?
was it the Popliteal?
Sure was. Okay, so I'll tie that vessel off now. Just lift up on that for me gently, please. I'll see if there's any connective tissue that I can grab and suture together here. There really isn't too much. All right, so most of this is going to close, but some of it I'm going to have to leave open to heal by second intention. And I will bandage this for at least a week. So the tumor was diagnosed as a sarcoma on a pre-surgical incisional biopsy, not cytology. Question about whether you can have numbness of the digits. You probably can, although we would never know because the dogs can't tell us. Okay, so I've got a little bleeder in here somewhere. Oops. That's not what I wanted. Not sure if I'm going to be able to get that out. Nope. Can I get suction turned on, please? Will the table come up anymore? Thank you. Okay. Doesn't look like a major blood vessel. I think that's all I'm going to get. Closure-wise, at least proximally. I'll try to do a little bit more distally. Okay. All right, can you switch sides again? Just lift that up for me a bit, just the whole thing. So post-op care on this guy is just going to be a bandage and then recheck in a week, and then probably leave the bandage on until this heals by second intention, which I imagine will be about 4 weeks. Yeah. Just trying to decide.
The skin from this side and try to.
Yeah, I don't think we need to, and I don't like doing release incisions in case I got a dirty cut. I think I'm just going to let that go. Can I get some 3.0 PDS, please? And I'll just put in some little cruciates on the top there because it looks ugly. So it's unlikely that, so this is a soft tissue sarcoma, and so even if it came back a grade 3, the likelihood, number one, of it metastasizing is virtually zero. Number two, chemotherapy, systemic chemotherapy, doesn't prevent metastasis in dogs with soft tissue sarcomas. And you could consider, if you were worried about local recurrence, something like metronomic chemotherapy, which has been shown to reduce local recurrence in dogs with incompletely excised soft tissue sarcomas. Although the publication has come under some scrutiny, generally people agree that metronomic chemotherapy, if you have a dirty margin and you don't have radiation available and you don't want to recut, then that's a reasonable thing to consider. And just have to decide whether I'm going to try to pull that skin across. I really don't think it's going to do any good. I know this is going to heal by second intention. All right, so can I get some melalin, please, and some stirrups? I'll zoom out to show you guys how I put on a bandage. I'm not worried about the space between the toes. So yeah, that's just not an issue. This will not be infected. It will not get infected. The dead space is not a concern. Yeah, no issue there at all. Question about electric chemotherapy, that is an option. Probably, yeah, so if local recurrence, that would be an option. And also, if we wanted to prevent local recurrence, like if we get that biopsy result back and the margins are incomplete, then we could do electric chemotherapy to try to prevent it from coming back. So I'm just waiting for my bandage materials. Can I get some lysostip? I'm going to put some collagen foam in there to help if I'm getting any oozing, and also it might act as a substrate for some second intention healing as well. No benefit to putting honey in this because it's not an infected wound. And this may just pop out at the first bandage change. Sorry, bandage stuff is coming? So it'll be able to walk straight after surgery, and it will completely heal in about 4 weeks, I would imagine. So melalin, stirrups. That's great, thank you. All right, so first I'll put a stirrup on underneath. And then I'll put a melalin over the top. So, just not too hard because the tape will come off. And I'm going to leave those toes exposed so I can see if we're having any swelling. I think I will go up over the ankle just to keep it from slipping off. Have to be a little careful going over the ankle because if they get a crease in the bandage, they can create a tourniquet. So bandage changes we'll do, first one probably in about maybe 3 days. And then every 3 days until we get granulation tissue, and then about every 5 to 6 days after that. And you want to be careful how tight you put on this melalin because you can create a tourniquet, and cause necrosis of the foot. And I've seen that many times with other people who put their bandages on too tightly. Can you just lift that foot up for me, please? Secret to a good bandage is lots of cast padding. And just make sure that you don't put the stretchy stuff on too tightly. So that's going to be a conforming bandage and your vet wrap. So that it's just basically placed on with maybe, just a little bit of tension on it, but not much at all. All right, so, and there's a comment, don't forget the nail clip. I think that's a very good idea. Do we have nail clippers in here? We'll do it on recovery. Thanks for the reminder, that's a very good idea. All right, so I'm just gonna, regarding rinsing the wound, I put bupivacaine in there, which is a local anesthetic. Just going back to make sure I haven't missed any questions. Love the slip knots as well. I think that I got all the questions. So there's a question, why didn't we just cut through the joint? In this situation, like usually if I'm doing an amputation, I'm taking out P1, P2, and P3. I'm going to do exactly that, cut it through the joint. But in this case, we had to cut through the bone because if I went through the joint, I would have had a dirty margin. And if I went all the way up and took out the bone from the proximal joint, which is the tarsometatarsal joint, we would have breakdown of the whole tarsometatarsal joint, and the dog would not be able to walk again. So no treatment before this. Low-grade soft tissue sarcoma. I did not put a tourniquet on. I could have, but I didn't. Definitely limb amputation would be way too aggressive. Taking off that toe is a much better option because it's a low-grade soft tissue sarcoma. It's not going to metastasize. So I'd rather it recur, and then if I have to do an amputation later on, than do an amputation right now. So I think that's everything. All right, so if you haven't already done so, please subscribe to our channel. Make sure you turn on notifications. That is it for me today, by the way. I'm not going to live stream anything else, but hopefully tomorrow I'll have a few more to go. Anyway, thanks a lot for watching, and we'll see you